So yes, I'm Gerry Hodgson from Cascade 3D, and we're an IoT and data analytics company. And we've been providing our Cascade Connected Care platform now for coming up to 10 years. And it's been incredibly interesting working with so many different organizations over that period of time, really working on this the transformation across to using digital and digital technologies as part of the care pathways, and that work that needs to go ahead there with all the staff and engaging with so many different people to make sure that it becomes an integral part of the way that the systems are delivered. Now, for us, the key part of this is trying to keep people at home, and we'll come on a little bit in a moment around commissioning. But the way that we can use these technologies, and you'll hear from so many of the providers today with GPS locators and other tech, other IoT technologies, and selecting those devices, and it's actually our superpower, if you like, which is working with the frontline staff to deliver personalized technology-enabled care. And really behind that is making sure that people can stay living within their own home for as long as they wish to, and obviously safely as possible. And what I wanted to share with you today was some of the case studies from many of the projects that we've been working, but I've just got 4 for you today. And really coming back to that point around commissioning, we're often asked, where is the evidence? What now is the evidence after so many deployments of IoT? How do we know that this technology really does help within the budgetary constraints that there are? So the case studies that I'll just talk you through there will really focus on that around keeping people safe and selecting a different range of issues that those people have faced. So first up, we have Colin, and Colin was first identified because of weight loss, and the carers were really quite concerned. Although the freezer was well stocked with food, the IoT sensors had been able to show that although there was activity in the kitchen, the fridge would get opened, actually the appliances weren't being used. And when they asked Colin, he was very convincing around saying, oh yes, I do eat regularly. I go out with my friends and family, and we have meals out. And so that would help the carers then lead to phone calls with the family, and actually he wasn't. So the care plan was able to be adjusted to be able to make sure that hot meals were prepared during the day, a sandwich was left in the fridge then for the evening, and then that backed up by the use of the sensors to be able to reassure people that was happening. The next one, Agnes. This was an interesting project for us because it really revolves around the integration of sensors alongside the virtual wards. Now, Agnes had asthma, or has asthma and diabetes, and you'll see there just from that slide quite extensive periods in hospital prior to engagement with the virtual ward. 40 days there over a period. And really this revolved around high anxiety, being able to manage her condition, which really, when you have an asthma attack, it was really quite severe. And what we did there was to integrate and install Bluetooth medical devices alongside Amazon Echo Show. And just listening there to Tom, in terms of talking about integration of Alexa, being able to speak and see people. And in fact, that's how the community matrons were able to talk and see the data from those medical devices to be able to work with Agnes. And what it was able to do was over that period of her getting used to using the devices at home, really reduced her anxiety and helped with managing those conditions. And in fact, brilliantly, they're just 3 days in hospital in a period, similar period afterwards, really around helping somebody understand the condition and reducing anxiety. So for Mary, this is really quite pings on the heartstrings there, being a lonely, purposeful walker. Again, what's really important about the integration of IoT with the alarm receiving centres is, of course, if doors are open, people are going out of the house at night, they may or may not take their GPS locators with them. But really, really important there that those responder services are in place to help people, if they do leave the property, etc. But what the sensors were able to show, and the staff that were working with Mary, was that really what she was out looking for was to find somebody to talk to. And so the care plan actually was increased from the short sort of 15-minute visits that she was having just to prepare a meal or help her, get up and about. But by extending that to an hour each day, Mary was able then to, kind of fulfill that need to talk to people. And I think that's another really, really important area in terms of using devices like the Echo Shows or video calling. And we're so used to it now, and it does give a way for people to to engage with others in a way that wasn't available to us. And finally, just to talk about Bob. So Bob has a cognitive impairment, and with it, his family live locally, but they would like to take him out with the grandchildren. But if Bob had a bad night or he was out of routine, he would often become incredibly irritable. And so, going out with the grandchildren and that noise wasn't a good day for anyone. And so the sensors have really been able to help the family in terms of understanding how Bob's getting on. If he's had a good day, then okay, let's prepare and we can maybe go out. But if not so good, if his pattern's a little bit disjointed and he's not sleeping so particularly well, then that's a better day to stay in and for the family to sort of reassure him at home and just help sort of settle things down.